Hey there everyone. In the previous video we had studied about the back of thigh, the complete chapter in two parts. I'll link that in the description. Please check that video out. So today we are going to start with the front of leg. So let's start. So we are going to see the surface landmarks first. So what are the surface landmarks? So anterior view, in the leg we have this tibial tuberosity. So this is an important region, important surface landmarks. Then this is for the great sphenius vein on the medial side, and the medial malleolus is present on the tibia, okay, on the anterior lower surface of tibia. We have the medial malleolus, and lateral malleolus is on the fibula, okay, on the fibula, anterior lower layer of the lower surface of the fibula. So lateral bone, fibula, we have lateral malleolus. Medial bone, that is the tibia, we have the medial malleolus. Now these are the tendons, EDL tendons and EHL tendons. We'll study about the muscles soon. Okay, on the posterior side we have again the muscles of the these are the muscles of the back of thigh, back of leg. We will study that soon. We have this is called the plantar surface, and whatever is on the anterior, that is called as the dorsum of the foot. Okay, so these are the surface landmarks, important surface landmarks. So now muscles, we have 5 muscles in the front of leg, or the anterior compartment of leg. It is also called as the deep peroneal compartment. Okay, the deep peroneal compartment, because most of the muscles are supplied by the deep peroneal compartment, deep peroneal nerve. Okay, so the muscles, we have this muscle, that is a tibialis anterior, extensor hallucis longus, extensor digitorum longus, peroneus tertius, and extensor digitorum brevis. So these are the 5 muscles, and these 5 muscles are supplied by the deep peroneal nerve, and this EDB, that is the extensor digitorum brevis, the smaller one, it is supplied by the lateral terminal branch of the deep peroneal nerve. Okay, deep peroneal nerve, it has a terminal branch, a lateral terminal branch, so it is supplied by this nerve. So yes, see, both the longus are supplied by deep peroneal nerve, and the brevis is supplied by the lateral terminal branch of the deep peroneal. We are done with the muscles and the surface landmarks. Muscles overview only. We'll study the muscles, origin, insertion, nerve supply, action in detail in upcoming videos of this chapter. Now we have 2 fascias for the leg. We have superficial fascia and we have deep fascia. So for the superficial fascia, in the superficial fascia we have superficial veins, cutaneous nerves, small arteries, and lymphatics. You see the color coding. For veins I've written with blue, for nerves yellow, for arteries red, and for the lymphatics I've taken purple. So anyways, we are going to study the superficial veins and cutaneous nerves in detail because they are important. The small arteries and about the lymphatics, it is not given much in the textbook. Actually, it's not given at all. Only about these two they have given in the textbook, that is the veins and the nerves, or in the superficial fascia. So see, for the superficial veins we have total of 4 superficial veins. Okay, we have 4 superficial veins, and for the cutaneous nerves we have 7 cutaneous nerves. Okay, this is a large number. We have 7 nerves, that too only in the superficial fascia, so it is kind of complex. So let's break it down in easy way. Okay, so the dorsal digital vein. Okay, the dorsal digital vein, the first vein is a dorsal digital vein. Each toe has 2 dorsal veins. Okay, each toe, it has 2 dorsal veins. Suppose this is the toe, so this is one nerve. Okay, this is one vein. Okay, vein, we need to take blue, right? So okay, so this is one vein and this is the second vein. So see, each toe has 2 dorsal veins, adjacent veins to toe join to form 4 metatarsal veins. So this one, the adjacent vein, it joins to form a metatarsal vein. Okay, dorsal digitorum vein on the medial side of the great toe forms the medial marginal vein. Okay, the dorsal digitorum vein on the medial side of the great toe, okay, great toe forms the medial marginal vein. The lateral side of the little toe forms the lateral marginal vein. Okay, as we know that the toe is on the medial side and the little toe is on the marginal side. Big toe or the great toe forms the medial marginal vein. Lateral side, it forms the lateral marginal vein. Okay, we'll see in the diagram below. Now the second one, we have the dorsal venous arc. Okay, it is very important to remember, it is very important to know. So it is a dorsal venous arc. So this was about the dorsal digital vein. Digital because it is near the digits and it is paired. Okay, so yeah. Now the dorsal venous arc lies on the dorsum of the foot, of course, proximal to the metatarsal bone. Okay, proximal to the metatarsal. First comes the tarsal. There are how many? 7 tarsals. Okay, 7 tarsals bone, and then we have the metatarsal. Okay, metatarsals, and then the phalanges. Okay, so it is situated near the metatarsal bone. So this is it. Okay, so like this. Okay, it is forming an arc. Okay, so this is suppose the toe. Okay, these are the toes. We know that each toe has got two veins. Okay, two veins as we saw earlier. So they are they are coming together to form this arc. Okay, now the great sphenius vein, this is very important. It is in the medial end of the dorsal venous arc plus medial marginal vein. Okay, so the medial end of the dorsal venous arc and the medial marginal vein, I already told about the medial marginal vein. It is formed by the medial part on the great toe. Okay, on the great toe we have seen here. So it was about the medial. See, dorsal digitorum vein on the medial side of the great toe forms the medial marginal vein. Okay, medial marginal vein. So medial end of the dorsal venous arc. Okay, medial end of the arc and medial marginal vein forms the great sphenius vein and passes upward and passes upward at the medial malleolus. I told no, medial malleolus is present on the tibia, to the medial side of the tibia. Okay, medial malleolus of the tibia ascends medially to reach back of the knee to the popliteal fossa. Okay, popliteal fossa, it continues as a popliteal vein. Okay, so first we saw this veins, then they continued and formed the dorsal arc, and these arc along with the medial marginal veins and their ends go to the medial malleolus of the tibia, then go to the go medially and reach the popliteal vein. Okay, sphenius vein is behind the sphenius nerve. An important point to be noted, that the sphenius vein, it is behind the sphenius nerve. Now we saw the great sphenius nerve, it is really big. Now we're going to see the small sphenius nerve. Okay, the great is formed by the medial one, medial marginal, and the small is formed by the lateral marginal. Why it is medial side is greater? Because we know we are studying about the great toe, right? So great sphenius vein, just remember it that way. Small, we have a pinky, not pinky finger, a pinky toe. Okay, the little toe, it is small, so we have it is on the lateral side, so it is lateral end of the dorsal venous arc and the lateral margin vein of the little toe, as I've already discussed, same as the medial one, but this is lateral, that is medial, that's it. Ascends to the lateral malleolus, that was ascending to the medial malleolus, this is ascending towards the lateral malleolus, runs upward to reach the back of knee, continues as the popliteal fossa as well, popliteal vein, accompanied by the sural vein. Okay, that was the important point here was that it was running behind the sphenius nerve. Here the important point is that it is accompanied by the sural nerve. Okay, so this is about the superficial veins. Now we're going to see the cutaneous nerves or the superficial nerves. We have the infrapatellar branch of sphenius nerve. Okay, if you haven't checked out my video on the branches of the sphenius nerve, please check out that video. I'll link that out in the description. Okay, so it pierces the sartorius and deep fascia of the sartorius of the medial side of the knee. Infrapatellar, okay, below the patella, so downward and forward, supply skin over the ligamentum patellae. Okay, so this is which one? Intrapatellar branch of the sphenius nerve. Now this, we have sphenius nerve, actual nerve, branch of posterior division of femoral artery. It is a branch of posterior division of the femoral artery. Okay, now pierce is the deep fascia between the sartorius and the gracilis. My pen isn't working. Okay, the sartorius and the gracilis. Now supplies the skin on the medial side and the leg and medial border of the foot up to the ball of the great toe. So sphenius nerve, I've already told, the great sphenius nerve is formed by the medial margin. My pen is not working. Okay, the medial, okay, the medial margin, medial marginal nerve, vein. Okay, the medial marginal vein, we had that, right? So this is in the same way we have nerve also to the medial side of the leg, to the medial border of the foot and the great toe, because great toe is present on the medial side of the foot. Now the lateral cutaneous nerve of calf. Okay, calf is the region, the posterior region of the leg. It is commonly called as the calf. Okay, and the muscles lying over there are commonly known as the calf muscles. Okay, it is a branch of the common peroneal nerve. The lateral cutaneous nerve of calf, it is a branch of the common peroneal nerve. Pierces the deep fascia over the lateral head of the gastrocnemius. So lateral cutaneous nerve, of course, lateral head of the gastrocnemius. Remember the lateral head of the gastrocnemius. Supplies skin of upper 2/3 of lateral side of the leg. Okay, supplies the lateral side of the leg. Now the superficial peroneal nerve. Okay, it is a branch of common peroneal nerve, divides into lateral branch and the medial branch. See, if I were to give an overview about this, so this is the common peroneal nerve, divides as the common peroneal nerve, divides as the superficial branch and the deep peroneal nerve and the superficial peroneal nerve. So the superficial peroneal nerve, as of course we're studying the superficial fascia, right? So the superficial peroneal nerve, it divides into the lateral part and the medial part. Okay, lateral part and medial part. Okay, and it supplies entire dorsum of foot. Okay, it supplies entire dorsum of foot except for these four. Let us see what are those. Lateral border, because it is supplied by the sural nerve. The lateral border, it is supplied by the sural nerve, as we saw in the veins. Know that we had sural vein accompanied by the sural vein on the lateral side. Okay, so on the lateral border we have the sural nerve. Okay, medial border is by the sphenius nerve. Okay, lateral by the sural, medial by the sphenius. Okay, cleft between first and second toe by the deep peroneal nerve. Okay, the cleft that is present between the first and the second toe, it is supplied by the deep peroneal nerve, and the distal phalanges of the 5 toes is supplied. Okay, that also does not is not supplied by the superficial peroneal nerve, because these nerves are taking part, so of course that nerve will not be taking part. Now talking about the sural nerve on the lateral side. Okay, lateral side, branch of the tibial nerve. Okay, common peroneal branches, we have the superficial peroneal nerve and deep peroneal nerve, and again lateral branch and medial branch. But for the tibial nerve we have sural nerve is a branch of the tibial nerve, supplies the lower half of the back of leg. Okay, supplies back of leg, lateral border of foot, tip of the little toe, lateral border of foot from lateral border to the tip of the little toe, because the little toe, it is present on the lateral side. Now talking about the deep peroneal nerve, it is a branch of the common peroneal nerve, supplies the cleft between first and second toe, as you have already seen. Now the digital branches of median and lateral plantar nerves. Okay, supplies the toes and the nail beds. This is not for, this is the nail and. Okay, this is and like this. So lateral supplies the lateral one half of the toes, medial supplies the medial 3/2 of the toes. Okay, medial 3/2 of the toes. Not necessary to remember for university exam, but might be useful for if you're preparing for PG, can be asked as a MCQ. Now we are done with the superficial fascia, done and dusted completely. Now studying about the deep fascia is a very small portion. Okay, the deep fascia. So see, okay, this is tibia bone on the medial side, and this is fibula bone on the lateral side. Okay, the tibia, the fibula. So whatever you see here with the pink color is the anterior compartment, and whatever you see here with the blue is the lateral compartment, with the light blue, with the dark blue is the posterior compartment. Okay, so I'm going to explain in detail. Yes, so we have the anterior compartment, lateral compartment, and the posterior compartment. Okay, lateral near the fibula. So okay, So see, the anterior compartment is separated by the medial compartment by which septum? The anterior intermuscular septum. Okay, let us clearly write here. The anterior compartment separated from the medial compartment by the anterior intermuscular septum. Okay, now the lateral compartment is separated from the posterior compartment through the posterior intermuscular septum. So let us also write that the lateral separated by the posterior intermuscular septum. Now the anterior anterior compartment separated with the posterior compartment by the medial intermuscular septum. Okay, the medial intermuscular septum. So you need to remember this one. Okay, you need to remember this. Now we're going to see which nerves are present in which compartment and all. So see, in the anterior compartment we have the superficial peroneal nerve. Okay, the anterior compartment, superficial peroneal nerve. Lateral we have the deep peroneal nerve, and here we have the tibial nerve. Okay, here on the posterior we have the tibial nerve. Okay, one important correction that I would like to make, I don't know what I've done. So see, for here this should be the deep peroneal nerve, and this one should be superficial peroneal nerve. Superficial peroneal nerve. So okay, anterior compartment we have deep peroneal nerve, and for this one lateral we have the superficial peroneal nerve. So this is about the deep fascia. Now talking about the retinacula, we have two retinaculars, okay, in the front of leg. Retinacula, what is retinacula? Or retinacula is plural, retinaculum is singular. It retains the tendon, okay, holding the tendons in place. This is a connective tissue, or a fascia that is retaining the tendons. This is called as the retinacula. Okay, so on the front of leg we have two, on the lateral side we have two, on the back we have only one. So the front is also called as the extensor compartment, right? So we have superior extensor retinaculum and inferior extensor retinaculum. For the lateral side we also call it as the peroneal compartment. So we have superior peroneal not ligament, superior peroneal retinaculum, okay, retinaculum, and inferior peroneal retinaculum. For the back we have the flexor retinaculum, because back of the leg it is the flexor compartment, right? So the flexor retinaculum, simple. Front side पे two, that is superior and inferior extensor because it is the front of the leg, and retinaculum because it is holding the tendons. Okay, now two are there, that is the superior and inferior. The superior one, it is rectangular, as you can see it is rectangular. Attachments to the medial side is lower part of the anterior border of the tibia. Now tell me one thing, the medial bone is the tibia, right? And this retinaculum, it is near the ankle joint. So lower border of anterior because we are studying the extensor compartment, border of tibia because we are studying the medial side. So it is very easy to understand. So on the medial side, attached to the lower border because ankle joint, anterior because extensor compartment, border of tibia because it is a medial bone. So medial side pe anterior part of the lower part of the anterior border of tibia. Same on the lateral side, lower part of the anterior border of the fibula because it is a lateral bone. So these are the attachments, the rectangular attachments. Now medially it encloses, okay, it splits and it encloses it. SPLITS, splits and encloses. S for the synovial sheath, T for tibialis anterior tendon muscle. Okay, so this is how you can remember it. This is the one mnemonic that I've created by my own, not a mnemonic but a way to remember. So now the inferior extensor retinaculum, again it is Y shaped. Okay, the superior was rectangular shape, so the inferior is Y shaped, it is below the superior, and this portion is called the stem of the Y, and these two is called the bands of the Y. Okay, so we have an upper band, so this is the upper band, and we have the lower band. So the bands are situated towards the medial side and the stem is towards the lateral side. So if this is the lateral side pe we have the stem, and the medial side we have the bands, the upper band and the lower band. So the attachment to the lateral side is the anterior, non-anterior of course extensor, okay, non-articulating surface, superior surface of the calcaneum bone. Okay, calcaneum is one of the tarsal bone. Okay, on the lateral side it is present, so it is obvious. Anterior non-articulating surface of the calcaneum. Okay, that is on the lateral side. Medial side, upper band, it goes medially upwards, medially upwards. Anterior border of medial malleolus, right, medial malleolus upper, upper side pe it is situated. So the medial malleolus goes medially upward to get attached to the medial malleolus, which is present on the tibia. Okay, present on the tibia. And for the lower band, it is going medially downward, medially only but downward, to attach with the plantar aponeurosis. Okay, in the upper limb we had palmar aponeurosis, in the lower limb we have the plantar aponeurosis. Okay, the plantar aponeurosis. So let us study the relations. Okay, the stem of this Y loops around the extensor digitorum longus and the peroneus tertius and the synovial sheath. Always remember, it is always with the synovial sheaths only. Okay, so the EDL and PT for the stems. Upper band, tendons of the tibialis anterior, extensor hallucis longus and the synovial sheaths. So EDL and PT and EHL. So how do you remember? Just remember D, the letter D comes first and the letter H comes after D. So first is the EDL for the stem, and the upper band we have the EHL, that is after D. Now for the lower band we have see, it is passing superficially okay, it is passing superficially tendon of the tibialis anterior and extensor hallucis longus again, dorsalis pedis artery and the deep peroneal nerve. It is a very important, okay, very important. Now what are the structures passing under the retinaculum? So the mnemonic is given in the book BDC, so I have taken it from there. The Himalayas are never dry places. Okay, the Himalayas are never dry places because it's snowy, it's cold. So T for tibialis anterior, it is holding the tendon. Okay, tendon. Okay, I forgot to mention, it is a tendon of the tibialis anterior. H for the extensor hallucis longus. A for anterior tibial vessels like the anterior tibial vein, anterior tibial artery. N for the deep peroneal nerve, of course. Dry places, D for digitorum and P for the tendon of the peroneus tertius. So two muscles we have, the extensor hallucis longus, extensor digitorum longus and peroneus tertius. Four muscles actually, four. It is not enclosing the extensor digitor B I was writing. Okay, extensor digitorum brevis. Okay, it is not enclosing the brevis. Okay, then to the anterior vessels and the deep peroneal nerve. Okay, so muscles, vessels and nerves it is holding. So this is how you can remember it. Now talking about the okay, we are going to talk about the artery in the next video. The anterior tibial artery, course, beginning, termination, its diagram, relations, branches along with the diagram, and then the deep peroneal nerve, root value, course, beginning, origin, the branches, and then at the last clinical anatomy, and we are done with the chapter. Thank you so much for watching the video. Please check out the description and please don't forget to subscribe. Thank you.